the biggest risk factor for death due to COVID is actually the age of the patient. Somebody that's 80 and above, if there's COVID, the death rate is nearly 15%. I mean, it's a 1 in 6. That's very high. One thing that really concerns us is that there's a lot of asymptomatic carrier. Young people are more likely to become asymptomatic carrier. But if they get infected with COVID, they go back to their parents or their grandparents and pass on the infection to the parents or grandparents. It can be very serious for them. So you would have seen in the news there's a rollout of COVID in several countries: US, UK, Israel, and Singapore, and China, Brazil, Indonesia. So also had rollout vaccine. There are a lot of vaccine that is under development, but there's a few that's been approved. I just talk you through the main types and the name of the vaccine. Okay, the one that you hear in the news now is mainly the Pfizer vaccine. That's mRNA vaccine. Also, Moderna is also an mRNA vaccine. And then the vaccine that is produced by China is inactivated virus vaccine. And the one that's also been approved in UK, AstraZeneca, is the adenovirus vaccine. Sputnik 5 is the one that is licensed in Russia. This one has also gone through the phase 3 trial. And then there's still some other type of DNA that's under development. There's DNA. A lot of people are concerned about mRNA vaccine because it's a new vaccine. They think that it can alter your DNA. That is not true. Okay, the mRNA vaccine cannot alter your DNA, so you cannot become Frankenstein because you take mRNA vaccine. mRNA also doesn't stay in your system for very long. You inject the mRNA vaccine, you get into the cells, it tells the cells to make the virus protein, and then this mRNA get degraded very quickly, and it disappears in the body in a very short period of time. Our own body-made mRNA, the average, the half-life of our own natural mRNA is about 4 minutes, because we need mRNA to make protein that is necessary for the body survival. Okay, the one that is approved in most countries is Pfizer. Moderna has been approved in America and UK as well. The one that Malaysia order is Pfizer, and we also order some CoronaVac that's from China. But the healthcare workers is very likely to receive the Pfizer vaccine. It should arrive at beginning at the end of next month in Malaysia. And the Prime Minister want to be the first person to be injected with this vaccine. The next one we'll be getting is very likely the AstraZeneca vaccine, because it's cheap. The adenovirus is actually a chimpanzee virus, but it's modified, so it's harmless to human. Okay, the vaccine has been approved in several countries. Like in UK, they've approved the Pfizer-BioNTech vaccine. The company that developed this vaccine is actually BioNTech, German company. Pfizer just funded, so they put their name to it, but most of the work is done in Germany. Moderna is the one it's also mRNA vaccine, and then the Oxford AstraZeneca vaccine. Oxford, because most of the research is done in Oxford in UK. In America, they approved the Pfizer vaccine and Moderna vaccine. China, there's approved Sinovac and CoronaVac. Sorry, I I didn't put down Singapore, but Singapore also approved the Pfizer vaccine. Malaysia, the approval is pending, but it will be very soon because there's all the data is there and has been analyzed very closely in US, UK, Israel. Okay, so what about the dose? Okay, Oxford AstraZeneca is given intramuscularly in the arm, 2 weeks. 2 doses, yeah, 2 doses, 3 weeks apart. Pfizer vaccine also 2 doses. The recommended dose is 2 doses, 3 weeks apart. But in some countries, they try very hard to give everybody the first dose vaccine, like UK, because the death rate in UK is very high. It's over 1,000 a day. So what they try to do is try to give as many people as possible. They're given about 4 million vaccine in UK. It's a Pfizer, the Pfizer one, and some AstraZeneca one. Moderna vaccine is also given intramuscularly, 2 doses, 1 month apart. Sinovac is 2 doses, 14 days apart. But the researcher in Sinovac, it might be a bit too soon to give it 14 days. They say they are looking at giving it 3 to 4 weeks apart. The reason for giving 2 doses is that the first dose will stimulate the immune system to produce some antibody, but you need a second dose to boost the antibody to a level that provide much better protection. Some early data from UK suggests that if you only give 1 dose of Pfizer vaccine, the protection is only about 2/3. But if we give 2 doses, it's 95%. So far, 95%. I'm sure many of you have read in the internet, the news, saying that China vaccine is only 50% effective when the trial done in Brazil. In Indonesia, it's about the study showed that 70% effective. But this efficacy that you read about refer overall efficacy. Okay, this includes the very mild symptoms like sore throat, a bit of fever. But so far, all this vaccine that is approved show that they are 100% effective in preventing pneumonia, admission to ICU, and death, which is what we want. For me, that is the most important thing, because that is what we are trying to prevent hospital admission. Whether a vaccine is 70% in preventing a bit of flu or sore throat, or 60% in preventing fever, today those are minor symptoms that are not really that important. Okay, so this is the efficacy. Okay, 95% in preventing mild to serious symptoms, but all of them 100% effective in preventing serious COVID. But one of the main things that will limit the use of the vaccine is the storage. Okay, the Pfizer BioNTech vaccine, unfortunately, it needs to be stored at least -70 degrees. So it needs a special fridge, which we don't have in our hospital. So we need the government to buy the fridge, and once it's distributed, it can only store in the normal fridge for a few days only. So it needs to be used up quite quickly. Moderna, it's also mRNA vaccine. It can be if it -20 up to 6 months. I mean, our vaccine fridge can store Moderna vaccine quite easily, although it's not very big, but it can go to at least -20. But the normal vaccine fridge cannot store Pfizer vaccine for long. The Oxford vaccine, it just need regular fridge temperature. Even your own fridge, you can store Oxford Zeneca vaccine easily. The China vaccine can also be stored at regular room temperature. The Russian vaccine can be stored in regular fridge temperature in dry form. Okay, the main reason why for Moderna and Pfizer vaccine it need much colder temperature is because mRNA is not a stable molecule, so it has to be stored at much lower temperature. So it limits the use of Pfizer vaccine in a lot of developing countries, in Kampong and all that, because you can't transport them easily in -70 to rural area. The China vaccine, the Oxford Zeneca vaccine is actually much easier to transport. Also a lot cheaper. So efficacy, I talk about the efficacy is in preventing complication of COVID. Okay, but one thing that I like to emphasize is that there's no data on the prevention of transmission after vaccination, because if it's the medicine is injected into the muscle, your body can produce IgM, IgG that will prevent serious COVID. It is very likely that even after vaccination, you can still carry COVID because your nose, the lining of your own nose does not have IgG antibody. So you can still be, you might not have symptoms or a very mild symptom, but you could still carry the virus if you are infected. You can carry it to other vulnerable people. So even after vaccination, you still need to take precaution like wearing masks to prevent infection to elderly, to patients. This has to be done until about 70% of the population is vaccinated. So in Malaysia, it's probably very unlikely that we will get 70% of the population vaccinated by the end of this year. Probably sometime next year, we should be able to get herd immunity, because we need to get 70% of the population to get vaccinated to get herd immunity to break the chain of transmission. How about adverse event? Okay, I'm sure that some of you are very worried about this a serious side effect, because you see a lot of things that are on the internet, and I will just show you a few of them later. There are some very common side effects which are common to COVID vaccine, like mild flu-like illness, because you are getting your body to produce part of the virus protein. So your immune system will react to the virus-like particle. Those virus-like particles are not dangerous, but when your body reacts to it by producing antibody, launch an immune response, you will get some flu-like illness that's usually quite mild, maybe headache, a bit of fever, a bit of pain at the injection site, but they are not serious. Very, very rarely people get allergic reaction, but it's extremely rare. Okay, some of you might have seen this headline. Say, well, 23 old people died after given COVID vaccine in Norway. Oh, so this vaccine is dangerous. But you have to understand that in Norway, they give it to all the old people, including those with terminal cancer. They are about to die. So not surprising that if you give hundreds of thousands, some of the people that are expected to die. They did not die because of the vaccine. They died because of the underlying health condition. Okay, in all the 23 that died in Norway had over 75 years old and have underlying health conditions such as cancer. No young people in Norway that's given vaccine has died. These are the people that are expected to die. Okay, and then you might see this on Facebook. Okay, this lady put out this news. Okay, the nurse fainted after the Pfizer vaccine and then died 10 hours later. Okay, we are worried. So I don't want this vaccine. But it's actually fake news. This nurse that was given vaccine, when the news came out, is working happily in the hospital. It is no, the news that she died is like fake news. Okay, to put your mind further at ease. Okay, this is the Prime Minister of Singapore receiving the Pfizer BioNTech vaccine, which is what the frontline workers will be getting. Okay, this is the President of USA, Joe Biden. He's a high-risk group. He's 78 years old, receiving the second dose of Pfizer BioNTech vaccine. And closer to home, the President, most of you might know, this is the President of Indonesia. He's receiving the China's Sinovac vaccine. So if all these world leaders are not afraid of the COVID vaccine, why are you worried? Okay. Okay, one more of question is that all the studies of vaccine is done in people above the age of 16. There's no study done in the age of for people under the age of 16. So we don't know whether it's safe for those is under 16, but we think it's very likely it's safe. One of the reasons why they didn't do study in those is under the age of 16 is because this young people don't die and don't get serious illness due to COVID. So if they give it to young people, it's very difficult to assess whether the vaccine is effective or not because they don't get illness anyway. The other group that we don't have data is pregnant women. Because this study is simply not done in pregnant women. But for all the rest, it has been proven to be very safe. Okay, so in conclusion, COVID vaccine is safe and has gone through phase 3 clinical trial before approval to use. The side effect is generally mild. It is very effective in protecting against COVID complications. So with that, this is my last slide. I'll be very happy to answer any question that any of you have.
Okay, I want to ask, do you do assessment before we give vaccine to our staff? Any assessment,
Yeah, I mean, in generally all vaccine, we don't give it to person that's suffering from flu. Okay, if they are not well, we generally don't give the vaccine because if they are having flu or they're having UTI fever, we generally don't advise giving the vaccine at that moment in time until they recover. Because for such patients, it'll be very difficult to assess whether the subsequent fever is due to the underlying illness or it's due to the side effect of vaccine. So wait for people to recover.
All right, okay. And then after I've been injected, for example, I've been injected a vaccine, so I will have some mild side effects, right?
Majority of the people no, but some people can get some pain from the injection site, or they can get mild fever and mild headache.
Okay, how about those who have allergies?
That's only in the minority of the patient, but any vaccine can give you some
mild discomfort.
Mild side effects.
Okay, how about those who have severe allergies? Severe allergies, they are allergic to Panadol, they're allergic to everything.
We will still advise the people to have vaccine, but we will observe them.
Oh, all right.
So if the the one that we're concerned about is anaphylactic reaction, which can happen very quickly. So for those that have a lot of allergy, we give the patient vaccine. We observe them for about an hour. If they don't have this anaphylactic reaction, then it's okay.
Dr. Sun, just one question. Yeah, you say the vaccine. There's 2 doses of the vaccine to be given day 1 and day 21. Let's say we have taken the first vaccine on day 1, but when it approached day 21, we develop, let's say, URTI or fever. The vaccine has to be postponed. Is it still effective if we take the second vaccine, let's say, the 4th week or the 5th week later?
Yes, I mean, based on the data, it's safe because this, based on what we understand of the science, yes, because what is the second dose of vaccine is to stimulate the immune system further from the initial stimulation. I mean, it's safe. Your body will still produce antibody. After the first dose, it takes 2 to 3 weeks for your body to start producing antibody. What the main reason of giving the second dose is that the antibody induced on the first dose might not be sufficient. The other thing I like to emphasize is that after the injection, after your first injection, in the next 2 to 3 weeks, you are still very vulnerable because your body has not responded to the vaccine yet. So the first 2 to 3 weeks, you still have no protection against COVID.
So to go here, can I make a comment?
Yeah.
This regards to Prema's question. You do want to feel a bit sick after the injection because it means that your immune system is reacting, it's responding to the vaccination. If you don't have any response, I'll be worried because the problem with the messenger RNA is that vaccine is that they are very fragile and they need very cold storage. And if there's a break in the cold chain anywhere along the line, the vaccine may not work. So the fact that you don't get any reaction may be a concern because apparently the vaccine are so immunogenic that you should have some local pain. You may not have any systemic reaction, but you should have some reaction locally. Secondly, regarding the pregnancy, I think at the moment, the feeling is that the technology behind the messenger RNA is so safe that there should not be a contraindication to get for pregnant ladies to get vaccination, even though studies are not being done. So in America, where there's a raging epidemic going on, a lot of doctors actually feel that it is safer to go for vaccination even though you're pregnant than to run the risk of getting infection by COVID. Because if you're pregnant and you get COVID, you're very likely to get very, very sick. Okay.
Yeah. Yes. Thank you, Dr. Goh. I mean, what I say is that there's no data on pregnant women, but if they are at risk, they should still receive the vaccine because the risk of getting COVID is a lot higher than this unknown the theoretical risk of very rare complication because you are pregnant.
Yeah.
So I hope all of you would be reassured, and when it's available, I think I will be the first one to get it if I can. But whichever one is available, because I mean, we're very likely to get the Pfizer vaccine first, but if the other one is available, I'll just go for it because the most important thing is to prevent hospital admission and serious complication.
Yeah,
The
David,
second thing is that
Dr.
with,
Ling,
with,
yeah.
with the reaction, the side effects, you're more likely to get it with the second dose rather than the first dose. Because first dose, your body has never encountered this protein before. So the most you get is some soreness. The second dose, your body might have a stronger reaction because it has encountered the protein. It's already encountered the protein once. Okay, David?
Dr. David Ling here. First, I'd like to thank Dr. Soon for taking the initiative to have this talk among the hospital staff. When we submitted the name list to Ministry of Health for our health workers, for our hospital staff, there are a few staff who are very unwilling. We call it vaccine reluctance, unwilling to have the vaccination because of fears of the side effects and the new nature of the vaccine. I hope this talk allays your fears. Don't be scared of having the vaccination done. Just yesterday in Cebu, 8 hospital workers, health workers were infected with COVID. The incidence of side effects from vaccination is much, much less than COVID infection. The severity of the effects of vaccination is much, much less than COVID infection. There are no known confirmed deaths from vaccination. So it is still much safer to have the COVID vaccination. The second thing is because of the side effects, like what Dr. Goh mentioned, there are some local effects like the injection site, there's some pain, that is okay. But a number of them, but still the incidence is quite low, may feel malaise and feel a bit tired. So because of that, we will not inject all the staff at one go. We will vaccinate a certain percentage of the staff, wait for about 2 days. If they are well, then we inject their colleagues, because we don't want everybody to feel tired and nobody comes to work. So we will arrange how the rota, the schedule of when you get vaccinated and all that. Regarding pregnancy, if I'm not mistaken, this vaccine is not used for children below the age of 16. But in America, they are going to start, they probably would have started by now, if not by next month, immunization for the young and maybe the pregnant. So if you have fears about getting pregnant after getting the vaccine, that means that you become pregnant after you get the vaccine. Of course, if you are worried about that, then you may need to take precautions not to get pregnant. Yeah, this is only for ladies lah. Males don't need to worry. Yeah. So if you are worried, I think there are about 15 staff that are pregnant. So we have to find out at what stage they are now. Regarding breastfeeding, whether it's safe for breastfeeding mothers, theoretically, it is safe, but we will find out. Probably Dr. Soon would like to find out whether there's any contraindication or if some of our staff are breastfeeding their babies. So these are my comments. Once again, thank you, Dr. Soon and Thomas, for arranging this talk.
Yeah, I mean this vaccine is very safe for lactating mother. In fact, it can because once a mother start producing antibody, this antibody can cross the this antibody can be expressed in breast milk. So when the baby drink it, they will have some protection against the virus.